Welcome to the Atrómitos Way podcast, where we have meaningful discussions on the challenges in healthcare and the solutions behind them. I am your host and producer, Liz Church. And today, ladies and gentlemen, I have the great opportunity to introduce another member of the Atrómitos team to sit with me here on the Atrómitos Way, Amanda Rodgers. Amanda Rodgers is a dedicated public health professional with a deep commitment to making a difference in her home state of Idaho. And today's conversation will allow the audience to get to know her personally and then know her professionally, following her journey into healthcare to navigating the intricate and challenging landscape of public health in Idaho. So, without further ado, hi Amanda.
Hi.
Welcome to the podcast. So, before we dive into your background, I do this, I don't want to call it torture, but it kind of is torture to my team. Ask you some fun questions so the audience can get to know you better. So, first one I've got for you. Would you say that you are more an introvert or extrovert?
So this is highly debated, and I consider myself an ambivert, or I call myself an outgoing introvert. So it's debated because my introvert friends are like, you are not an introvert. You do not get to claim this. You are way too outgoing and people know you. And then my extrovert friends often find that I'm like, yeah, I need to go be alone now, So I'm just solidly in the middle, I think.
That is really, I can't imagine that. Maybe it was because I'm very introverted. It's crazy. I didn't even think about it being an actual thing because
I love presenting. I love being I do have the weird thing where I actually do like being in front of a crowd. I do get energized from that. I know.
Weird, Amanda. I can't do that.
I know. And I think part of it has to do with a background in teaching and a background in whatever, and just getting comfortable with being in front of everyone. And but then also I just have to go be alone. Sometimes I'll be turn off my phone and I'm gonna go hike for 2 hours. And I don't want to say a single word. I don't want to hear a single word. And I'll just be gone. And one way it was described to me, though, was if you go to a party, where do you find yourself? Do you find yourself in a corner talking to 2 or 3 people, or are you circulating the room? And I do both. But at the end of the day, I actually love it when I find people I like, and then I'm like, okay, I don't have to talk to everyone anymore. I'm just going to talk to you in the corner.
I usually find myself gravitating towards the people that are like, I'm gonna hang out in this corner for the rest of the night, and I'm like, I feel safe here. I don't have to move.
Yeah, I go visit that corner, and I spend a long time there, and then I'm like, okay, I'm going back out.
I can't find that energy. That energy's. I mean, the last time I saw Michelle, we were at the Healthcare Heroes thing that's here in Wilmington, and she would have to come get me. Like, okay, we're gonna go now, and I'm like, I'm not ready. I don't wanna. So I was kind of sticking with Michael, but then when he would gravitate, I'd be like, I can't. I've been abandoned. So then I stayed with my husband. Yeah, that terrifies me. It in a way that's just doesn't seem like it resonates through the podcast because I can do this really well, but with people, it's like, no, I can't. I'm too terrified. Oh god. All right, so then moving onward. You have a very interesting background, and we're gonna just talk about part of it real quick. So your first degree was in English, which tells me you're an avid reader. So do you have a favorite book that you could share with the audience and explain why it's your favorite?
Yeah, this question was pure torture, right? Yes, to even ask for a single one.
I told you,
I
that
I didn't follow rules.
Of course, come on.
I will give you categories. No, I'll make it brief. I will say, because I'm in Idaho, I have to give a couple shout outs to Idaho authors. So Tony Doerr, All the Light We Cannot See. I mean, that's now becoming a TV series. Alan Heathcock, he was one of my professors in college, and he has a great book called Volt. So, and another one called 40, but check out those. And then when it comes to nonfiction, David Sedaris, 100%, satirist, why can't I say that word? Essayist, satirist, whatever. He's sardonic and hilarious.
Mm-hmm.
Um, Fiction, I like Neil Gaiman
Hmm.
or Gaiman. I never know how to say that
I
correctly.
know,
I'm
I
not
don't
gonna
either.
lie.
I think it's Gaiman. I don't know.
Yeah, Cormac McCarthy and Barbara Kingsolver. And then if I have to say like the book, I will say Barbara Kingsolver, the Poisonwood Bible.
Ooh.
And the reason I'm saying that's my favorite is it's one that it's huge and I've legitimately read it 3 times, like multiple times. Like I've gone
Mm-hmm.
back to it through multiple life stages. I read it in high school
Mm-hmm.
and then, which did not have the capacity to comprehend it then. Read it again in college. And then I read it again in my 20s and like later in my 20s. And it evolved for me in meaning every time. And it's this amazing story that follows these daughters and this wife whose husband decides to pick up their life from southern US and move to Africa to be a missionary, and he had no idea what he was doing. And it's just like following his family and this life that they've been thrown into, following their dad slash husband who was on an interesting journey of his own.
Mm-hmm.
And I don't want to spoil it. It is a darker book, but it's amazing. It has amazing look at colonizing and our ways of which we consider ourselves in the world and how we consider ourselves to like do good for the world. And
Mm-hmm.
um, also, I mean, just mentionings of how the patriarchy plays throughout that. I don't think that Barbara Kingsolver says that, but I'm gonna say that.
You're not speaking for her, but this is your
I'm not speaking
interpretation.
for her, but those are the things that I've come to understand as I'm now sitting here, you know.
Mm-hmm.
But over time, it like seeped in over many years.
Mm. I wonder what your interpretation will be, if it'll be the same, and maybe in 10 years if you pick it up again. Try to wait a decade and see how you feel, and see what
Yeah,
you
yeah,
things you recognize, things that change. I don't know. Idea. You don't have to. Just throwing it out there.
I probably will.
So then, going into the last question I've got for you. So you went from an English major to obtaining your master in public health. So can you give us maybe not too much of a deep dive, because you and I spent like an hour talking about your deep dive, and I was looking at you like, holy crap! I mean, we're not going to do the expletives and the faces I was making, but let's talk about what prompted you to make that switch to the healthcare sphere.
Yeah, so like any good story, it was a twist of fate and truly not something that I initially had decided to do at all and kind of found myself doing. So, like any good millennial, I graduated into a recession, um, was living in a state that had one of the lowest unemployment rates in the US at the time, or highest unemployment rates, lowest employment rate, you know what I'm saying? And I had a Spanish minor and I spoke Spanish. And I was like, I'm going to get out of here for a while
I'm gonna leave.
I'm going to leave the US while it's going through this. So I joined Peace Corps, or I applied to join for Peace Corps, which is a US agency that works in lower income countries that have invited them in to work on their skilled workforce, which is problematic in its own terms. You know, they do send a lot of 20-year-olds who don't know what they're doing places. But and I was one of them. So being an English major, I assumed I was going to be sent to go teach English somewhere. And I actually was originally lined up to go do that. I was going to go somewhere in the Caribbean and teach English. And my paperwork sat somewhere on someone's desk too long, and I missed my opportunity to go. Like it didn't end up that I could go for that line of service. So they re-looked at my resume. They were like, well, you didn't make it into that one. And this is like a year-long process, right? So they're like, it's going to be like another 6 months before we can find something for you, but let's try and see what else you have going on in there. Looks like you used to be a camp counselor in high school. And so in high school and early college, I had participated in something called the Idaho Drug-Free Youth Summit, and I was a
Mm-hmm.
counselor. And it's exactly what it sounds like. It promotes drug-free lifestyle. So they basically were like, cool, youth development. That's what you're going to do. So I got sent instead to Peru, where I worked in youth development. And one of the top goals was helping promote a healthy lifestyle. And they essentially trained us for 2.5 months, 2-ish months on public health. So they trained us on how to do a community needs assessment and how to go in and work with stakeholders and do key informant interviews and surveys and SWOT analysis and all the things. And then sent us out and told us that our first 3 months of service, we were only allowed to do that. And so I ended up in this rural community in Peru that I lived in for 2 years and made a lot of amazing relationships, had a life-changing experience. And my primary goal ended up being, after doing my community needs assessment, teaching sex education in high school with the local OBGYN. And so it was just like the most amazing project I had. I had other projects, but it was my absolute favorite. And then I was like, can you do this in the US? Like, do people do this? And there were other volunteers who were public health volunteers. And I was just like, wait a second, like there's a whole line of work that I missed here because I was an English major, creative writing major. I was sitting alone in a room writing essays, and not out doing community driven work. And so I came back to the US and basically was like, how do I do that? Like, I don't think I could ever do anything again that doesn't serve the well-being of everyone. And I just did everything I could to try and get into public health, but I didn't have the degree in it, so no one wanted me. So I worked at a hospital as a patient registrar. I was working in triage, in an ER, and in the call center, and just doing everything I could to kind of like make my way where I could in quote unquote healthcare. And I had a friend from Peace Corps who had gone back to college, gotten into a fellowship program at the University of Arizona in Tucson called the Peace Corps Coverdell Fellows. And basically, it's a fellowship that's offered for returned Peace Corps volunteers to pay for their entire graduate program, and in exchange for volunteer work and service work in the US. And I then started studying for the GRE at my job at the hospital. Like, I took all of my books and studied on all of my shifts, and got into the University of Arizona magically in a college of public health, and a line of work I had not really done except for Peace Corps, and then begged, I'm not joking, the director of the fellowship to accept me. I sent a Hail Mary message about 6 weeks before school started. And I was like, I noticed that you haven't told me no yet to this fellowship. So maybe there's still a yes in there, and I will blow my life up. And I was living in Washington at the time, Washington State. I was like, I will blow my life up and pack my car, and I will be in Tucson starting classes if you say yes. And then later that week, she said yes. So I literally, a few days before moving to Tucson, didn't even have a place to live. Packed my car. This inevitably was like also leaving a relationship. It was just something I felt so called to do that I was truly willing to blow up my life to do it. And as another turn of fate, I ended up being able to live with my friend who I did Peace Corps with, who told me about the fellowship. So and that's when I got in, and the University of Arizona was great. I had an amazing experience there. The Peace Corps Coverdell Fellows, like, shout out to Georgia. I've told her many times that she changed my life. So here's another thing. It changed my life. And I actually started studying, first and foremost, sexual violence prevention, because I got placed with, magically, a mentor who's one of the top researchers in the United States, Dr. Mary Koss. So I just had this very serendipitous, magical experience of everything working out in my favor in so many steps along the way, and leading me into public health. And and then eventually I realized that I hadn't lived in Idaho. I'm from Idaho. I hadn't lived here for about 9 years. And I realized I just wanted to come home. Like, I had this very stark moment. I had gone into a doctoral program. I was actually getting a DRPH, Doctorate of Public Health.
Mhm.
And I just had this moment of realizing like academia wasn't the route I wanted to take. I wanted to work directly with communities. I didn't want to just be doing, I didn't want to be spending 3 to 5 years in research and then potentially staying in academia, even though DRPH is more a practice based title and
Mhm.
degree rather than a PhD, which is more research. I just tended to gravitate towards more research. And yeah, and I just kind of realized like this isn't the route I want to go. I want to go to where the community, maybe not the community level, but above the community level, to
Mhm.
where I can help decipher policy and budgets and the funding that comes through to help filter that out to communities. And
Mhm.
so I truly just did a Google search of public health jobs in Idaho, and an evaluation specialist position came up at the Idaho Department of Health and Welfare. And I'm like 100% qualified because of all the research I've been doing, and evaluators and researchers are very hand in hand. And so, yeah, it was my chance to come home. I had to do some really hard things and say goodbye to people at the university and turn down my doctorate program. It was a huge decision, but not one I took lightly at all. And it just was. I just felt like it was time. It was time to make a different change.
Mhm. Mhm. And I think when you and I were talking about this, what I ended up summarizing was like you found your calling. I suppose that's the way to look at it. Is that you found yourself in this crazy journey, and then you came to a place where you're like, it's okay to go back home for a little bit. You
Yeah,
know.
yeah.
So.
I used to work for the Forest Service seasonally in the wilderness in Idaho, and Idaho has one of the largest contiguous wilderness areas in lower 48 states.
Mhm.
So I was literally living in the middle of nowhere. Like that's a real term. It's like I was truly, well, in the middle of the Frank Church Wilderness. And I had this moment where I was hiking after work because I was living in the wilderness, I was hiking in the wilderness, and I was between my master's and my doctoral program. And I just broke into tears in the middle of the trail because I realized, like, oh, this is home. Because it was my first opportunity to kind of come back because I lived away for so many years. And it's hard to do seasonal work when you're trying to be a real employee somewhere and do real
Mhm.
work. And Forest Service work isn't exactly public health work. It was just this lark for me to be able to go back and do it again, like I had in my undergrad years.
Mhm.
And yeah, it shook me. It just shook me, and I was like, I gotta go back to Idaho.
Mhm. So speaking of Idaho, we have a lot to talk about with Idaho.
Yeah, we do.
Um, I'm not going to recite the news for everybody. They can do it themselves. But let's see what's been going on in Idaho. But let's start with your professional experience. So, how has your understanding of public health evolved through your experiences, especially considering Idaho's current political and healthcare landscape?
Yeah, like I mentioned, I when I was thinking about jobs as I was leaving my doctoral program, I was like, well, clearly I got to go to the top. Like I got to go and to the top as best as I could in this quote unquote system, right? Like I wasn't going to
Mm-hmm.
the CDC, but I was like on a state level, the top is the Department of Health. And I thought, yeah, if I go there, then I help determine through research, through best practices, how money should be spent,
Mm-hmm.
and what how that should be spent with communities, and making sure that communities are getting the money that they need. And when I was working for the Department of Health and Welfare, which I did for 6 years, I often saw myself as like a liaison for community organizations and nonprofits and universities, as like a person to help break down the bureaucratic barriers, um, and to get them the funding that they needed, which was given to us through the feds and the federal government and state government. and and um yeah, I thought like that's the best way I can help people. And then over time, as our quote unquote small government, which means light policy, became pretty heavy policy in how public health runs, pretty heavy, as it started to get more and more like that, and I was able to help communities less and less. Like I was just yeah, I keep my coworkers, or my former coworkers, and I speak to my former colleagues a lot still. We use the word hamstrung or hamstring. Like, it was just like a common term. Like, we've been, they're just hamstringing us, or this, that, and that was the feeling. It was this feeling of like, we have so much capacity to provide, and we're being prevented from doing our jobs. We're being prevented from actually serving in public health. And that's when I realized that actually grassroots level efforts, a lot of times can get more done. And it was very hard to come to the realization that the system I was working in, which should have been the system that served people the best, that should have been the system that created the most opportunity, was not.
Mm-hmm.
And I will throw in there my own personal thoughts, being that, as long as we live in a society that runs off of capitalism, that runs off of the haves and the have-nots, and someone needing to be above someone and someone needing to be below, we're never going to truly promote public health on a system-wide level, like a full system-wide level, because it doesn't make enough money. It doesn't make enough money for our communities to be that well and healthy. And
just the thought that profit negates whether health is met is just insane to me. It doesn't seem human. It doesn't seem human at all.
It isn't. And also, like, that, in the context of Idaho, there's more going on there than just that. There's a lot more going on. And but it is something that consistently I've seen, that the grassroots level efforts are where people can actually mobilize. They can do it quickly. They can, quickly being the key term, because that is not something you can do in the government. And in fact, a lot of people who are trying to, I think, impede public health intentionally, they do that by making it slower. They do that by making it more ineffective. Mm-hmm. And it's a terrible thing to be part of an organization or an agency that cares so deeply and wants so much to provide, and is so incapable of meeting people where they are when they need it. Mm-hmm. And because of policy and bureaucracy that maybe initially was instituted in order to provide equity, and, well, a bad word now, equity.
I know. We'll get more words on the podcast.
I know, right? And to making sure that things are transparent and done, above board. Like, that is definitely where some policy and bureaucracy comes from, is that it was all about checks and balances. But then it went into a new realm where it was no longer about checks and balances. It was about preventing things from happening. And I was going to talk about this in a little bit, but I might as well say right here, the Idaho government has been, from the legislative, like our legislators and our leaders, they've been moving away from federal funding and moving away from working with federal government. And first of all, federal funding is one of the number one sources of funding for every state in the US. Mm-hmm. Like, it is how we work. It's our taxes coming back to us. It's how we address needs on a nationwide level. And Idaho is systematically starting to eliminate federal involvement. And that we can suppose could be part of trying to become sovereign and to no longer be beholden to federal agencies and requirements. Some of it, I can't tell if it's a misunderstanding or it's just, this is the cloak they're putting it under. There's this idea that, if we return federal funds, it'll go back towards our deficit. But that's not how it works. If we return federal funds that are allocated to states to work on different health initiatives, it just goes back to that health initiative bucket and gets redistributed to other states. doesn't go towards any federal deficit. It doesn't like help us be less in debt as a nation. And it doesn't better our communities. But it all on the Division of Public Health level within the Department of Health and Welfare, there has been a larger look at federal grants and seeing them as a regulatory burden. And at one point, one grant that I know of that was COVID relief funds was $11 million, and it was turned away by the state from the federal government. And that's just one of the grants. That it could measure up to more than, I mean, I don't know the exact number, like estimated maybe around $30 million. So that's money that our communities didn't get in addressing this emergent pandemic need. And all the other states got it. And there's no reason why we shouldn't have gotten it, other than our government decided it didn't want to be involved with that regulatory burden or with the being beholden, quote unquote, to the federal government. And I mean, we've seen data that shows that more Republican states fared worse during COVID.
Oh yeah. It was kind of one of those situations where you didn't want to laugh because so many people suffered, but you had to just hang your head, because it's like, why did you let all these people have all these problems? Why did you let your citizens suffer? Why?
Yeah.
What was the meaning of that?
And conservative politics is really, in Idaho, is really, like I said, working towards that sovereignty, working towards what they consider freedom from socialism. So working in having freedoms, that's in being independent, being sovereign, and having quote unquote rights. They're sovereign rights. However, a lot of it ends up actually being rights for some and not for all. And that's, more of what we can talk about.
Oh, do you have the ability to talk about, given the complex and dangerous government climate restricting progress and growth for Idaho, why did you decide to stay in Idaho despite the challenges?
It's home. It's home. And also, when I was in grad school, there was this moment where many of us were wondering where to go next, right? Like, where do we go from here? We've just gotten this education. We're now ready to go be professionals. We know about different programs that are running all over. We know about different states that are more likely to support different programming, which means in turn a better area for us to be a workforce. It's where we would want to work, right? Like, you want to work where there are jobs. And a couple of my friends came from red states, and I'm also clearly from a red state. Grew up in one of the most rural and remote communities in Idaho, in an isolated remote community that didn't even have a hospital. And we kind of talked about how sure we could go and work on these cool projects in these states that already have these really deep, profound, years in advance projects that have been going on, or we could go home and help. Like, we could actually be part of the help that could make our state great, or make our state healthier, and bring our education and our knowledge back to the communities that we came from. And that's definitely something that I felt when I was at the Department of Health and Welfare. It was really interesting to be from such a rural and remote community. I'm from a community that's designated frontier, which means it has less than 7 people per square mile. And my community that I'm from is less than, it varies depending on the local like climate with work, but workforce, but it usually hovers under 1,000. And I grew up in a community that really cared about each other. And I know that things have shifted and changed over time, and that was a different era. But I grew up feeling like I was being taken care of by my community, and that everyone put in their effort. I have a mom who is a philanthropist, and I watched her most of my life volunteer for various things around the community when she later became the president of a nonprofit that helped with emerging needs for community members, whether it be emergency food boxes or utility bills and services. And, you know, just being at home, even visiting now, my mom is answering calls from people in the community and directly on her phone line and then going and helping. And that's the community I grew up in. And so when I went and worked at the Department of Health and Welfare, I realized that there is a disconnect. Like Idaho is so rural and frontier, and then it has some major urban centers. And I'm living in Boise and working in Boise, so I would recognize when certain projects were being done that people wanted a rural voice or they wanted an understanding of different practices in rural communities to roll out these projects, and they were just struggling. And then I recognized, I'm like, oh, it's because you're not used to how things work there. And yeah, they're not going to trust you whatsoever. You represent the government in a system that's from outside of their community. Like, yeah, they're not going to just adopt that instantly, you know? And so I ended up becoming someone in conversations that would speak to my experience growing up in my hometown and understanding the culture of a small town and a community that is built on rugged individualism, who needs to be independent and feel independent, and like they're, you know, they're homesteaders, they're ranchers, they're people who are really making it on their own, and but still need these services, like really need them, and like how to make that accessible and acceptable in a community level, because asking for help and getting help is also a huge tenet that is difficult to have when you're in that rugged individualist mindset and ethos.
Yeah, yeah, and I think, and it seems foreign to me because like where I am, there's I think they did the census, and like we're the smallest like county, as in like size, the way the borders cut out, but we have like 100,000 and some change. I think it's like twice that now. So like I'm surrounded by people all the time. All the
Oh
time.
yeah, the county I come from is the largest in size with the least amount of people. It is truly just land for, it's just, yeah, you can drive for an hour, not, and like maybe see a few houses. And it's very remote. I don't have cell service sometimes, most of the time in my parents' house where I grew up. I don't have cell service there. Still, you have to have, if you're going to the community where I'm from, it's smart to have like a Garmin InReach, like, which is, yeah, a GPS system to help get messages out if you're spending any time in the woods around or just like out recreating in the area. Also to have a Life Flight membership, because that is the way you're going to get emergency care, because there is volunteer EMS in the community and a rural clinic that is has like limited hours and doesn't have consistent staffing with a doctor. So, and yeah, so that's those are two things that are pretty, and that's not just my community, right? Like that's pretty well representative of a lot of Idaho.
That's crazy to me. When I think about this, and one of the things that you had mentioned when we were talking is like that sense of community and people not realizing that they need it. And I feel like with a lot of the things that are happening in Idaho, it's kind of like it's trying to break apart. It being the government, it's trying to break apart that grassroots, that community, to keep it so it's strong. Does that make sense?
Yes, and you know it is like often the irony is a lot of conservative policies end up hurting conservative small communities the most, right? But I mean, I will say like I do still see a lot of community cohesion in these communities. It's not that there isn't community cohesion, it's that they don't want anyone outside of the community to come in, you know. It's kind of it's a joke, and I feel like I can kind of make the joke. I sometimes am not recognized in my own hometown, since I have left. And so people do have like a little bit of a wall up initially when I come back home, and then they see me with my mom and like totally melt, and it's no long that wall's no longer there. I look quote unquote city. Um, and but I don't know if you ever watched South Park growing up, but there's like the joke by like, we don't take kindly to your kind around here. It's like that's kind of the like everyone is very kind, I will say though. Like people are nice, people will be kind to you as you're passing through, but when it comes to like, oh, I want to come to this community and make change, people are going to be like, whoa, whoa, whoa. Like, who are you? Who are your ancestors? Like who, how do you have roots here? How do you know us? No one's averse to having things that help them. It's just the package in which it comes in, right?
Yeah. And well, change is really hard in itself to convince others that it's like, this is okay. Trust me. We can totally expand and go on and on about your life in Idaho with these fun things. I mean, I just really encourage everybody just read up on the news, see, and you will have stuff that's coming out in the next couple months about certain things in Idaho,
Do
especially
you
with.
want me to speak to some of those things more specifically?
You can.
Yeah. Yeah, I'll go ahead and say our Idaho's government has made pretty much attacks on education, autonomy, and health, like across the board. If we look at just the top things you'll see in the news, the Idaho Library Bill, which was HB 710, made it so basically it was a mandate that for Idaho public libraries and schools that any materials that were considered quote unquote harmful to minors needed to be redacted and taken to areas that only adults could access. And any adult could make a complaint about a book deeming it adult material. And a lot of times that ends up being content that talks about sexuality, gender identity, concepts that are quote unquote worldly, and are arguably not things that should be taken out of the grasp of someone who's a minor, who's could be 15, 16, 17, 18, and this is including in books in school. So basically it gives a concerned parent or adult access to basically get rid of any book that they decide from a library and removing access from a minor to it. And that includes fines if the library can't comply, which I mean, we all know how well, funded libraries are. They just have all that money and all that time. Yeah. And this honestly has hurt smaller communities the worst. So rural communities are getting hit the hardest with this bill because rural communities have small libraries where they can't separate content. Like some libraries are maybe 1,000 square feet. So we have a rural remote community in Idaho that had to basically make it so no children could come in their library. And because they could not decipher out what was an adult content and what was children content because it was all in the same room. And that library also had a lot of after school programming that was really consistent, that brought in money and that gave the community access to programs for their children. And now they're trying to find workarounds with it. They have to get, school, like not school, but a parent permission and working with things so that they can still come there and use it and have selected books for them to access from the library. But it creates a huge burden and a barrier to communities having access to books and education and content and honestly like autonomy, right? And how they choose to educate themselves.
Yeah.
And moving on, continuing to talk about autonomy. So we have a lot of anti-trans bills that have gone through. HB 71 banned all gender-affirming medical care for minors in Idaho. And that makes it illegal for a health care provider to provide those services. And I just have to say, like, I understand that there are arguments on whether or not to do something with someone who's a minor, but that's where a medical professional should decide and give counsel to the family and child and the
Mm-hmm.
minor, not our government. Our government shouldn't be deciding how families choose to live. It should be that the medical professionals that they work with can help them make an um, educated decision based
Mm-hmm.
on what's best for them.
Yeah.
And then we also had House Bill 421, which makes it so that sex and gender definitions have been amended. And so, like, meaning that there is only a binary and you're either female or male, and it is what you were born as. So that is now required, and you cannot self-identify. So that's very detrimental to our trans community. And as we've had professionals on here come and talk about all of the ways in which that hurts our youth and our communities who are already honestly like at in a desperate, or not desperate, but disparate situation with their own mental health needs and their health care. So
Yeah.
yeah. So and then of course we can't go without talking about our near total abortion ban. So the near total abortion ban was a trigger law that was waiting for Roe v. Wade to fall, and basically came down the second that Roe v. Wade was overturned. And that makes it illegal for any provider to provide an abortion unless it isn't like literally the mother is about to die. So a provider literally has to wait for someone's vitals to fall to critical points in order to provide care. And it also makes it illegal for any adult to take a minor over state lines to get an abortion outside of state. But this has been, of course, been wrapped up in the Supreme Court with EMTALA, the Emergency Medical Treatment and Labor Act, because it's like you're going against the fact that we need to provide emergency services because many women were being flown out. Well, women were being flown out of state. We had a senator who lied point blank to the Supreme Court saying that that wasn't happening. And it in fact was, and we had health systems stand up and go, we don't know where Senator Labrador is getting his information, but here's how many people we've had to fly out of state for emergency abortions. Our neighboring states are now taking on a lot heavier burden with having people go over state lines to get medical treatment in their communities. Like even places like Utah, who has a 12-week ban. There's a huge increase of people going over to Utah, which we know not everyone has the ability to travel for an abortion. And it just puts so much strain on a woman's health in any instance, whether she's intentionally pregnant or not, to have to go through these means in order to get her health care met. Yeah. And this whole abortion ban did create backlash within the medical provider community. So we lost pretty quickly almost a quarter of our providers, and specifically in the OBGYN and maternal health sector. And that caused an entire hospital in northern Idaho to close. It was labor and delivery for sure that closed. And so that made it so every community had to reallocate where they were going to get their maternal health services and labor and delivery services, which meant that some people were traveling like 40 miles just to see a provider. And then locally, I've also, like in the Treasure Valley, we've had another labor and delivery hospital clinic close. And it's just, lack of providers. Like they can't keep it open with providers leaving, and OBGYNs who wanted to stay and work in the state, they just couldn't bring themselves to, because that's their livelihood. Like they are supposed to be taking care of their patients. They've taken an oath, and emergency abortions and helping people make those choices, whether it's an emergency or not, is part of their oath, and helping someone have health care. And they were basically put on the chopping block as being felons if they were to do their job. So for themselves and for their own livelihoods, they had to choose to leave. And that has created trickle down with other providers. Sometimes providers are married to other providers, so then you're losing other providers. And just knowing in general for those providers that their license and their livelihood and everything is at risk just by practicing, they choose not to practice here. Mm-hmm. So yeah, we are already at a provider shortage, and even more so now. But mm-hmm. There's all these other things like beyond that and like, yeah, I could go on forever about the abortion ban. You'll see something that I've written in the future that does go on a little bit lengthier, but there are other policies and things that have happened that aren't as like in the news and as big, that do trickle down and hurt communities. So they repealed the Needle Exchange Act, so our harm reduction program was closed down. We had the opportunity to fund pre-K in the state, and pre-K is known to just increase basically everyone's health and wellness, like across the board. It's known to everyone. When someone has gone to pre-K, they're less likely to use social services, and they're more likely to join the workforce and to go through higher education. It also increases the ability for parents to take care of themselves and their families and join the workforce. Like literally pre-K helps the community all around. Mm-hmm. And it was highly debated because, once again, this is one of those mistrust of the government thing. Essentially, people don't want the quote unquote state raising their children. And they believe that that should be a family's job, even if that means that prevents that family from actually having the full access to all the things that they could do to increase their livelihood, like having childcare so that they can go to work, and having free childcare so that they're not paying essentially an entire year's wage for that child to go. So we chose to not do that. And instead, everyone got a little, hey, we had a surplus, you got some money back. So I think every resident got like $600 in the mail. And which I'm like, I understand that some people like thrive off of getting that money and like need money more intensely. But I personally would have liked my $600 to go towards funding our community's wellness. We also let, this has been since amended, but there were a couple of years there where they let the maternal mortality review group lapse. And this is what actually reviews like why women have died within their span of time in the birthing process, whether it be before or within certain months afterwards. So our legislators let that group lapse. And so we weren't having any surveillance on it. I mean, there is surveillance on death records, et cetera, but no work group to review practices and like ways in which that could have been prevented, which, by the way, every other state has this work group. It has since been reinstated in the most recent legislative act, and they're going to be reallocating it to a different sector than the public health. And they're going to put it in the medical sector, which great, as long as it exists, We legislators basically put so much pressure on the State Department of Education and schools for having what is called the Idaho Youth Risk Behavior Survey. And this is the Youth Risk Behavior Survey is a national survey that is done through the CDC. The CDC pays for it to happen. Like basically it's a given. Every state does this, and it's the number one way to understand for kids. And I'm trying to remember if it's like 7th grade through 12th grade, or like it's basically like middle, junior, senior high age, to understand their behaviors and their patterns, and like in ways where we say like, has anyone ever like touched you inappropriately, and like understanding. It's one of the only indicators for knowing if anyone under the age of 18 has had any sort of sexual mistreatment or abuse, which by the way, about, 85% of sexual assaults are underneath the age of 18. So it was the only way that we could have tracked that. But it wasn't just tracking that. It was also tracking if they used tobacco and if they drank alcohol. And if they were physically active and how many vegetables they ate a week. And that got basically completely removed because it mentioned sex. And it wasn't like a direct thing where it was like, this mentioned sex, take it out. It was that legislators caused so much pressure on it that the State Department of Ed was like, we're not doing this anymore. Like, this just is getting too hard. And so Idaho is now the only state that doesn't do that. And it completely removes any way for public health professionals to know how to provide programs for this, for young people who, we basically need to know what's going on with them in order to help what's happening with adults, right? Like, this is upstream, And so, and then inevitably, sex education was also removed as a requirement. It's no longer mandated. So each school can decide if they're going to do sex education. And I believe that it's abstinence only is now like the only ways to do that. And so that basically got rid of the adolescent pregnancy prevention program on a state level. Yeah, I'm like, we're really queuing people up really well for an abortion ban by not educating them at all, right? Like, not allowing them to have any access, not acknowledging their humanity, not acknowledging their right to have any sort of education. We also, this last year, every year they have to approve of things like the summer EBT program. The summer EBT program is a program that gives people who are on EBT benefits additional money for their children who have now come back from school for the summer. And that did not pass. So just so many children who are now at home without that consistent meal at school don't have that, like, those families don't have those extra benefits that was literally just like a little bit more money added to a program they were already receiving money on. And a legislator actually made a comment about how she thinks that children should be doing something to demonstrate that they've earned that.
Oh, I remember that. Yeah, I remember seeing that. And I was like, all right, that's not good. I mean, there's a lot of explicitives that I could have said, but no, ma'am.
Yeah, because children should work to have food. not that, their families and their caregivers are in a position where they're trying their best to get them food, and
don't you understand? They're trying to protect the children.
Yeah, right. They're trying to protect them from being on welfare programs, which are, considered a negative. And in general, we're basically anything that says health equity, health disparities, social determinants of health, diversity, equity, and inclusion, any DEI thing, that is being attacked on a statewide level from our government, from our legislators, and public health professionals are not, even though like this is a key component to what work is, which is just addressing that certain individuals and certain groups have worse outcomes in different areas, right? Like, that's just how it is. Like, we can't acknowledge that. We can't acknowledge that there is a difference and it could be based on race. We can't acknowledge that there is a difference and it could be based on socioeconomic status. So that's basically completely torn apart any equity-driven work that's been on the state level. And it really, once again, that word hamstrings any ability to put forward any progressive. And when I say progressive, I'm not saying progressive in the liberal sense. I'm saying progressive as in like, we are going after this in a preventative upstream way. Like, we are going to be not being responsive and reactive. We are going to get ahead of the game, progressive, and try to help people before it becomes an emergency.
Yeah.
And, or we're going to try to address something that has gotten far out of alignment and gotten heavy in one way and not in the other, et cetera. And like, try to bring it more into balance. Like, that's what I mean.
Yeah.
And then there are just smaller ways in which, like I mentioned earlier, that it feels like, well, it doesn't feel like it is government impeding on how public health works in order to kind of prevent it from doing its full thing. And
Mm-hmm.
one of that is, they passed a Senate bill. It was like 1455, and it was by the Finance Committee, and it created essentially this level of bureaucracy that makes it incredibly difficult for um, the public health, the Division of Public Health within the Department of Health and Welfare to
Mm-hmm.
apply for grants. So it's a new requirement. Once again, I'm sure in the name of transparency and checks and balances, that they essentially send any grant that they want to apply for all the way up to the chain, like to the top for to the finance committee for the entire state. And there, within the Division of Public Health and within the Department of Health and Welfare, there are people in these roles
Mm-hmm.
that work to help with approving that you can apply for a grant, because you're looking at the statewide budget, right? Like, there are things to take into consideration then there. Like, what are we as a state applying for? What are we trying to manage budgetarily? Like, that's very common.
Mm-hmm.
But to create this extra step of sending it up just makes it incredibly difficult, if not impossible, for them to be competitive with responding to grants in time. Because if anyone has worked on a grant, whether it be from federal grant or state grant, sometimes you get a month, sometimes you get 2 months. And when you have to get together a team, you have to, work with stakeholders, you're doing everything you can to do your best effort to say, we want to apply for this. We want to make sure it's going to the right way, to the right places, and we want to demonstrate that we can do this well. I mean, it takes time to create those committees, to work with people, to make sure you're have all of your boots on the ground, and then also back in the office who are helping run everything from behind the scenes.
Mm-hmm.
And a lot of times there's already a lot of internal review processes to do those checks and balances that limit the amount of time you have to write. So then have to wait to get approval from this very high top tier portion of the state government that doesn't have any involvement in public health, and actually isn't in the public health department whatsoever. They get to determine if you applied for this or not. It's totally negating the professionals and their expertise. It's negating any sort of work that they've been hired to do, or to understanding like the breadth of how this can be rolled out. It's just seeing it as a line item. And as I mentioned, they're trying to reduce their regulatory burden with federal grants, so they could just decide, no, we don't want to manage that much money for this federal grant for this program. And that program could be anything from maternal and child health to diabetes and heart disease to environmental health, tobacco control, anything.
I feel like I'm lost in a lot of these things. So like you're talking about just Idaho, and I'm seeing all the states, all the 50 states, and the glorious things that are coming out of certain states. And so, that term could be turned in two different ways. There's the repression, and then there's good laws that are being done, like in Minnesota and Michigan. And then you see what's happening in Texas and Idaho, and you're just like, why don't you want to help people? I'm just so lost on that. And it's just, I think,
you have to like, here's what I gotta say. It's not even, it's like a culture thing. And it's so hard, because part of me wants to be defensive, even though I'm sitting here saying all these things. I'm like, here's all the ways in which our government is literally making it so we can't help people. And, like all of the brainwashing that's happening about, quote unquote socialism, blah, blah, blah. And I'm like, but I'm wanting to be defensive and be like, but I know this goes back to like, why am I here? I know these communities want everyone to be well and healthy. I know that people truly want their neighbor to be doing well, and they want others to be doing well. And there is a disconnect on how we all see that to be effective and how to do that.
mm-hmm.
Because some people think leave me alone. That's how I'll do well.
I can handle my diabetes by myself, thank you. Just
Right.
no.
Or they see the system that's managing diabetes is actually not being on their side. Like, you know, at the
Mm,
end of the day, it's like maybe they have diabetes and they want it to be managed and they want it to be well and healthy themselves, but they don't trust the people who are rolling it out. And, you know, and I get that because we do have, we within healthcare also have some very corrupt aspects. Like we're not like, we are not the superheroes and we're not the saviors either. There are aspects of healthcare like big pharma, you know, whatever. It's like
yeah.
all the things. And the fact that hospital administration is now like one of the largest income earners in the state, you know, it's like people are making money off of people being unwell. And so there's mistrust there.
Mm-hmm.
And for public health, the whole goal is to try and gain trust in order to better help everyone. Like but you can't start at a place where you're like, this is supposed to help you. Why don't you do it? You know, and you,
I can
and
do
you,
that.
I know. Darn
But
it, take your medicine. You know, like just kind of
yeah.
like, you know, that kind of thing. And you have to see it as like, well, there are also communities who have been forgotten for a really long time.
Yeah.
There are communities that have had to do this on their own for a really long time, and they're not about to accept anyone's help that comes in saying they're going to help when they're like, oh, what strings are attached here? No, thank
Mm-hmm.
you.
Yeah. 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 And I'm sure we can name a few communities that unfortunately have that mindset. But one thing I do, and this is like the perfect way to close the entire conversation. I find myself being um really hanging on the dread and like the feeling of that impending doom, like there's no hope left. So what keeps you motivated and hopeful about improving public health given all the things that's happening in Idaho right now?
Honestly, it's the people I know who are working in it. Like I mean, I have I would say a pretty strong group of people in my network in Idaho who are the people who care a lot, like
Mm-hmm.
a lot, and who are the people who are, I mean, amazing for the job. I just, you know, I don't know if it's because of the work that I do or whatever, but I seem to be surrounded by nonprofit executive directors who are doing amazing work in the community. I have incredible friends in public health that were my colleagues at the Department of Health and Welfare. And even if all in different places now, some are still there, some have moved on to other locations. I mean, some of the most dedicated, determined, smart, thoughtful, caring people I've ever met in my entire life.
Mm-hmm.
And some of them have been doing this a lot longer than I have. And they show up every day just passionate and trying to think of more ways to work and help people. And there have definitely been times where I have lost hope and lost motivation. And I've been like, you know what? Get me out of public health. Like, I'm done with this. I don't want
I
to
need
do
to
this
get out of
anymore.
here.
Yeah, get me out of here. Who's gonna hire me now? I don't know. But yeah, there have been times when like I just was like, this is a wild goose chase, basically. And I've been tricked into thinking that I could help people and I can't. And
Yeah.
but the people that I'm surrounded by, I mean, I'm still very close to that friend who I did Peace Corps with, who I lived with in grad school. Like, she works in Tucson still, and she's doing amazing work. And we talk almost every day about the
Mm-hmm.
work that we do. And so my sister-in-law is in public health. My other sister-in-law is in health insurance. Like, I have a brother who's a dietitian. My boyfriend's a psychiatrist. My whole network is like everyone top down
Mm-hmm.
in healthcare and in community care, like in community grassroots levels that just care about the well-being of our communities and our society. And I think that's like what community is, right? Is that it's like there are times when you don't have the strength, but everyone else does. Or there's times when all of you are just completely downtrodden and cannot think of any reason to move forward. And then you like sit in that together and then you keep moving forward.
Mm-hmm.
So as long as I am in Idaho, and even if I for whatever reason may leave Idaho someday, you know. I have people here that are just like anchors, just absolute anchors in the community, and in working towards basically a better community for everybody in every way sense that they can, that it makes me want to be here, and it makes me want to be part of that, and it makes me want to do right by them and by my community and just keep going.